Chapter 33 Transplant Drugs. Organ transplantation is a life saving procedure, and it's an acceptable treatment when organs will fail. There are currently more than 100,000 people who are waiting for an organ transplant. Unfortunately, for many of these organ transplants to be successful, immunosuppression is going to play a key role. Because unfortunately, the body's immune system will identify that transplanted organ as foreign tissue, as an invader, and will try to attack it in what we call graft versus host. And part of what we do to make sure that that organ is able to be successfully transplanted involves suppressing that immune system, suppressing that response. Induction therapy. This is immunosuppressive therapy administered pre transplantation and during the early stages of post transplant. And it provides intense immunosuppression with drugs designed to diminish antigen presentation and T cell response. It also reduces the risk of acute rejection during that initial transplant period. Basiliximab is a monoclonal antibody that works to inhibit the activation of lymphocytes and helps to prevent the body from mounting an immune response against the transplanted organs. This drug has many side effects, including abdominal and back pain, fatigue, dizziness, fever, chills, nausea, vomiting, edema, dysuria, diabetes, capillary leak syndrome, malignancy, and blood dyscrasias. Next up will be drugs like cyclosporin and tacrolimus. These work to suppress the immune system by binding to cytoplasmic proteins that help inhibit calcineurin phosphate. This in turn inhibits T lymphocyte proliferation. Some cautions with cyclosporin: this is going to be one of those drugs we avoid with grape juice, though it may be given with orange or apple juice to improve absorption. Some side effects would include things like dizziness, headache, acne, paresthesia, tremors, arthralgia, edema, electrolyte, metabolic, and lipid abnormalities, Stephen Johnson syndrome, blood dyscrasias, seizures, neurotoxicity, nephrotoxicity, hepatotoxicity, and diabetes. Co-stimulation blockers such as belatacept. These also work to inhibit T cell activation and proliferation while inhibiting T lymphocyte proliferation and the production of inflammatory mediators. Some of our large list of side effects will include things like infection, fever, cough, insomnia, GI distress, hypertension, increased creatinine, hypocalcemia, proteinuria, post transplant lymphoproliferative disorder, malignancy, acute renal failure, diabetes, just to name a few. Other maintenance therapies would be mammalian target of rapamycin inhibitors, such as sirolimus or everolimus. These are used in patients 13 years or older. And again, we're working to inhibit T lymphocyte activation and inhibit that antibody production. Side effects of sirolimus would include things like infection, fever, peripheral edema, GI distress, hypertension, tachycardia, UTIs, nephropathy, hepatotoxicity, venous thromboembolism, hepatotoxicity, interstitial lung disease, and osteonecrosis. Purine antimetabolites, such as azathioprine. These work to block purine metabolism and DNA synthesis, used especially for the case of kidney transplant rejection. Side effects would include things like leukopenia, thrombocytopenia, infection, malaise, myalgia, pancreatitis, hepatotoxicity, and chronic immunosuppression. Inosine monophosphate dehydrogenase inhibitors. These work to block the synthesis of purine nucleotides, prevent the proliferation of T cells and lymphocytes, prevent antibody formation from B cells, and inhibit the recruitment of leukocytes to inflammatory sites, used in the case of kidney, heart, and liver transplants. Some of the many side effects would include things like hypertension, headache, insomnia, blood dyscrasias, viral reactivations, edema, tremors, hypokalemia, neuropathies, acute renal failure, and interstitial lung disease. I'm assuming you're noticing a pattern that there are a lot of side effects that come with these medications. Corticosteroids, such as prednisone. This is used to both decrease inflammation while also suppressing the immune system, and particularly used in the case of acute transplant rejection. Some of the many, many side effects include things like sodium retention, edema, weight gain, infection, hypokalemia, diaphoresis, muscle atrophy, cataracts, insomnia, hyperglycemia, peptic ulcer disease, anaphylaxis, diabetes mellitus, Cushing syndrome, impaired wound healing, Kaposi sarcoma, and even growth suppression. There are several types of rejection. These occur due to again, that normal immune response responding to the foreign tissue the body identifies as an invader. There can be many types, everything from hyperacute, acute, and chronic. Anti-thymiocyte globulin, rabbit immunoglobulins. These block T cell membrane proteins and cause altered T cell function and lysis while prolonging T cell depletion. Side effects would include things like high fever, chills, headache, GI distress, dyspnea, blood dyscrasias, peripheral edema, malignancy, anaphylaxis, and cytokine release syndrome. Opportunistic infections is going to be another major consideration anytime we're giving these immunosuppressive drugs. You know, bacterial, fungal, and virals is all going to be major considerations, as these patients, once they have an organ transplant, do not have the same immune response, the same defenses to these pathogens that normal, healthy immune systems do. Adherence is going to be another major part of our patient teaching, is that they have to maintain that complex drug regimen, much like we talked about with our HIV medications. And failure to do so could lead to major consequences. The factors that affect adherence include things like episodes of rejection, comorbid illness and disease, the side effects of the drug themselves, as well as the costs. Many of these drugs are very expensive. We want to make sure we're educating the patient everywhere we can, both about the drug as well as the importance of maintaining that regimen. When treating these patients, we want to carefully look for cues and assess for signs of rejection, signs of infection, and any other compromised immune statuses. We want to instruct the recipient on the benefits of a balanced and healthy diet, accompanied by exercise. We also want to instruct the transplant recipient on proper adherence to the drug regimen, teach the patient to avoid anyone with active infections, and as well as teach the patient about any early signs of rejection infection they should be looking out for as well. For our first practice question, a patient is receiving cyclosporin after transplant surgery. Which of the following items should be avoided? That be A, apple juice, B, grape juice, C, orange juice, or D, grapefruit juice. And that's going to be D, grapefruit juice. And that's going to be also a very common ATI and NCLEX question, that avoiding grapefruit juice at all costs for any patients taking cyclosporin. For question two, which of the following are principles of immunosuppression? That be A, monotherapy reduces the risk of organ rejection. B, multiple drug therapy reduces the risk of drug toxicity. C, drugs which increase T cell response reduce rejection. Or D, drugs that activate lymphocytes reduce the risk of rejection. And that answer is B, multiple drug therapy reduces the risk of drug toxicity. And for our final question, a patient receiving an organ transplant was given basiliximab 2 hours before surgical transplantation. When will the second dose be given? That be A, immediately after transplant surgery, to B, 2 hours after transplant surgery, C, 4 days after transplant surgery, or D, 6 weeks after transplant surgery. And that answer is going to be C, 4 days after transplant surgery. But anyway, that's all I got for this chapter. I'll see you in the next slides.